Good morning, everyone. I'm Dr. Anita Edwards, Treasurer and Program Chair of Gateway Medical Society. I am standing in for our President, Dr. Lisa Isaac, who is out of town this week, and I know she would want to be here. Um, and so she is wishing us well. We are thankful that you have come to our program today, and we are thankful for the Black nurses who have collaborated with us in this topic today. As some of you may know, Gateway Medical Society is a component of the National Medical Society. Gateway Medical Society is a society of African American physicians, along with other minority groups in the city of Pittsburgh, who works on social and ethnical disparities in the healthcare system. We have been around since 1963, and we definitely feel that we want to close the gap in health disparities. We attempt to do that with these programs which we are having today, in which we do community conferences, and we try to have at least one or two a month, and so we hope you will come back. We also provide provider symposiums at least once or twice a year. And then we also have a gala, and so we encourage any of you to come to our gala where we try to help with the medical students and their costs so that they can continue in school. We also have a mentorship program for young African American males in which we are trying to mentor them definitely into college and hopefully into med school. So we feel that our mission and our vision is very important to the community, and we hope to be able to continue in this vein. Today, we're very grateful that the Pittsburgh Black nurses are with us, and they're going to give us a presentation on the power of prevention through vaccination. I'm going to introduce our moderator, Michelle Carter. Michelle has been nursing for over 25 years. She graduated from Community College for nursing as an RN. She attended California University of Pennsylvania for her BSN and Aspen University for a master's degree in nursing administration and management. Michelle's nursing practice is in long-term care setting. She presently is working as a director of nursing at Longwood at Oakmont for the past 5 years. She has received several certificates. She is certified as a dementia practitioner and a certified nursing director in long-term care. She is part of the Black Nurses in Action and the National Black Nurses Association and Pennsylvania Director of Nursing Association member. Michelle has been on numerous committees, participated in several outreach programs, and has stated she is part of the Pittsburgh Black Nurses and is co-chair for this monthly Zoom talk. We appreciate Michelle, and we thank you for helping us with this presentation today. Michelle.
Thank you, Dr. Edwards. As Dr. Edwards said, my name is Michelle Carter, and I just want to first thank everyone for joining us today as we give some education to our community and outside our community about COVID-19 and also all vaccinations. As we know, as we've gone through our pandemic, how important vaccination is to prevent illness and the spread of illnesses. Today, we have two wonderful speakers, Dr. Jennifer LeCue and Dr. Betty Baxter. Dr. Jennifer LeCue is a doctor of family medicine and psychiatry in her fourth year residency in UPMC St. Margaret's training program. She's from the California area and attended medical school at Rush Medical College. It has been her passion to be with health equality and serving minority and underserved communities was developed when she was in medical school. She provided nutritional education at local clinics and organized community health screening events. This commitment continued in her residency, where she helped develop the anti-racism curriculum for her training program, which exists to empower young doctors to understand ways systematic racism affects patient care and to be better advocates and providers equipped with the knowledge for their patients. She also has interest in maternal health, patient advocacy, and community engagement. In her free time, she likes to spend time hiking with her Labrador retriever, Maya. Our other speaker, which we're very pleased to have, is Dr. Betty Baxter. Dr. Baxter is the Associate Dean of the Undergrad Education Program and Associate Professor of University of Pittsburgh School of Nursing. She graduated from Louisiana State University Medical Center, where she obtained her BSN. She attended Texas Women's University, where she obtained her master's degree, and the University of Pittsburgh, where she obtained her PhD. She also attended the University of Mississippi Medical Center, where she was in a nurse midwife program. She has worked many years with our junior level pre-licensure students enrolled in the mother and baby nursing course at the School of Nursing at University of Pittsburgh. She also teaches the School of Nursing midwife program. She has research interests in the tobacco use among childbearing individuals and health disparities, including a specific focus on maternal mortality and morbidities. Her clinical interests align with her work as a certified nurse midwife, with a focus on providing childcare bearing age individuals across the lifespan. Dr. Baxter is a member of the National Black Nurses Association and the Pittsburgh Black Nurses in Action, and a member of the Kappa chapter Chi Eta Phi nursing sorority. She also serves as a co-chair of the Women's Health Community of the National Black Nurses Association, and she serves on the Commonwealth of Pennsylvania Maternal Maternity Review Committee. I'd like to introduce Dr. Jennifer LeCue as she starts our first presentation.
Good morning again. We are having some technical disabilities, that's not the right word, for problems. And so we're having problems sharing the slides. Just give us a few minutes, maybe you all can just have a small talk as we're working on this behind the scenes.
As we're waiting, I just want to let the audience know, once we have our slides up, there will be a question and answer session after each slide. You can put your questions in the chat box, and when we're completed with both presentations, we'll go through questions and answer questions that you have for both our presenters. There you go. Thank you.
Hi. Okay. Looks like we've got our slides almost. There we go. All right. Well, glad to be with you all. This morning, I'm going to be focusing on the COVID-19 vaccine. and just raising some awareness about that. So we can next slide. So just wanting to start with an overview of the COVID-19 pandemic. So there's just all the topics we'll be covering. So we're going to start with an overview of the COVID-19 pandemic, the disparities that it brought to light. We're going to be talking about how the vaccines were developed. We're going to discuss the benefits of the vaccine. I'm going to talk about some of the vaccines that have full FDA approval versus still in the emergency use authorization stage, ones that are available to the public, and then how do people get vaccinated. So to start, COVID has been with us for about 2 years now. So this initial graphic was made a year ago. And I, just in presenting, felt like it was a good moment to at least reflect on how long we've been in this new normal. And just remembering, January 2020 is when we can actually go back one. But January 2020, we all, maybe March 2020 is when we remember things really changing. But thinking back to January when we were first hearing about some virus coming from China, we all remember the shutdowns of early 2020, March, April, flattening the curve through the summer. This is when we're also we're seeing such terrible numbers of death among older patients in nursing homes. I was practicing a lot of psychiatry at this time. So just remember seeing so many patients struggling with loss of loved ones, the toll of isolation as well. And then kind of amazingly, thinking back, the vaccines were first approved end of 2020. So just to think we kind of made it through those first 9 months. But then 2021, it seemed like this hopeful year of vaccines. It also was the year of variants. So we probably remember the excitement of getting vaccines early in the year, but also slow uptake in parts of the country. And then end of 2021, Delta was looming, the concerns about were vaccines going to work. And then Omicron, just, December, January, where we've continued to see infections, death, talk of boosters. And so this exact number of the 968,000 deaths, I pulled it a week ago. I believe we're now at 975,000 deaths in the United States. That's just the United States. So just the terrible toll it's taken. And next slide. I feel like we can't also not talk about just the disparities that were brought to light. Not that I think I want to emphasize these were not new disparities, but perhaps COVID was just brought it to the forefront again, just thinking about who was dying from COVID. We know a lot of minority communities were disproportionately impacted, making up more of the deaths than they made up of the general population. So just this kind of graph on the right, you can see if the bar is red and that's higher than the blue bar, it actually means that there's more deaths than what the total population was. And next slide, I also think it's really important that as we think about even disparities, you can't not talk about racism's impact because we know there's not some inherent biologic difference in any way that's making someone more at risk. It's that there's been so many social factors along the years. And so I like this little person diagram when I think about my role, even in medicine, that healthcare makes up, maybe a fifth of a person's well-being. I think of that as my role as a doctor, that socioeconomic factors, environmental factors, just your income, your education, access to healthy food makes up so much more of a person's health. And so I think when taking a step back to think what was driving some of the disparities, and there's many, many policies, our nation has not been kind to a lot of minorities, but I just felt like a couple of things that I was highlighting. I think a lot of the kind of redlining in the 1930s ended up leading to a lot of just wealth inequities because of the ability for certain communities to not buy homes. And we see segregation of neighborhoods because of that, which has led to worse access to healthcare, schools, income attainment. There's also segregation even in the hospital system through the 1960s, where just care was not equitable. And just, of course, I'm not going to, this is very brief, so it's not all inclusive by any means, but we just know that certain communities have, unfortunately, had higher rates of disease, diabetes, heart disease, because of these kind of socioeconomic inequities. And so, COVID, we hear people that are higher risk end up having more comorbidities being older. And so we saw impact, especially the African-American community. So where do we go from here? How do we protect ourselves, protect our communities? You can go to the next slide. So we're going to get into vaccination. And I just want to start from a very basic level. And how do vaccines even work? I get this from a lot of patients. And if you didn't have an interest in biology, why would you know how these things work? And so just kind of in brief, a vaccine is, and until, the mRNA vaccine I'll get into as well, but it's essentially scientists have been able to either kill a virus or it's a very, very weak virus. And that typically, like when you think about like your measles, mumps, all your childhood vaccines were made this way. So you have this very weak virus that you get injected into your body. Your body has these immune cells that end up kind of recognizing this virus, but because it's weak, they fight it off. And your body does this very cool thing where it makes memory cells that kind of say, hey, if I see this again, it kind of ramps up its response much more quickly. And so if you ever saw that virus again, you would be able to fight it off more quickly. You don't get as severe of disease. The virus can't replicate and cause as many symptoms in your body. And I do like to remind people, if you have a small child and your doctor said, hey, you need another tetanus, you need that sometimes it's not uncommon to remind your body 2, 3, even 4 times sometimes. So a lot of childhood vaccines, you need multiple shots to make your body really remember the virus when you're exposed to it. And so I think as we go into the COVID vaccine booster talk, but this is the basics of how vaccines work. You can go to the next slide. And so in terms of the COVID vaccine, this was based off, I just have gotten a lot of questions from people too about how did we develop this vaccine so quickly? How is it safe? So just a little bit of history into mRNA research. So it actually has dated back to the 70s that we've been looking at mRNA for vaccines. So I find that really reassuring that it's not that we did all this research in 1 year and said it was safe, but we've been working on this for 50 plus years. In the early 90s, there's the first mRNA flu vaccine was tested. The kind of fancier technology to have this kind of like a lipid nanoparticle, which just means it's like kind of fats that surround the mRNA, was first developed in 2015. And of course, 2020, we remember our first kind of vaccine for COVID when Pfizer was approved. And what is mRNA? I'll just another quick brief biology lesson. So we probably have heard of DNA, like everyone has it, it's unique to the individual. That's sort of like the storage of everything to make up what makes a human body: eyes, ears, nose. mRNA is sort of like the instructions for your cells and how to make like an ear, an eye, a nose. And so from the mRNA, you end up getting some type of protein. So next slide. So how do the COVID vaccines work? Kind of in that similar vein, we were able to look at the COVID virus. You see kind of at this top left, and say, okay, it makes this little protein on the outside that is what our body might recognize. Probably you guys have heard of the spike protein. And we decided to say, let's just take the instruction manual for the spike protein and inject that into people's bodies. Your own cells take up that mRNA, because just kind of miraculously all mRNA or DNA, it's the same basic building blocks for all living things. And your body actually then uses its own kind of factories, I suppose, to then manufacture spike proteins that they put on the outside of their cells. Our immune systems respond to them in the way that they would respond to like a weakened virus and other vaccines. You get a bunch of memory cells. And so then when you actually see the COVID virus, you are ready to fight it off. It can't take hold of your body. You don't get as ill. And so just kind of some myth busters we can see here, your DNA doesn't actually change in any way from the mRNA. We're not giving you any part of the virus in the vaccine. and no microchips. So go to the next slide. Also with vaccine development, in that same vein of how did we do it so quickly? I just wanted to present kind of a normal timeline of vaccine development, which can take, 3, 4, 5, 10 years sometimes. But if we look at the top, that preclinical data part, that's kind of what I was mentioning with the mRNA. We've been doing that for about 50 years. And there's normally 3 phases of research. In the beginning, we're just making sure they're safe. So that's phase 1. Phase 2, we're looking at, is your body actually responding to it? And of course, safety, safety, safety. And then phase 3, we're looking at, is it working? The good thing and bad thing about COVID is people were signing up to be in the studies like crazy. And normally for clinical trials, we're studying vaccines that people maybe, I think vaccines have gotten rid of so many illnesses that we kind of forget how well they work. And so normally it takes a long time to get participants. It might take months to just get the few dozens of participants for phase 1 and then for hundreds of participants for phase 2. But we had 30,000 volunteers in just like the first 4 months of vaccine studies. So that gave us a lot of data much more quickly than traditional vaccine studies where you're just slowly recruiting people. It's a bit more of a slog. I think another important thing is that typically when businesses are developing vaccines, they don't want to lose money. So they tend to work more slowly to make sure it's actually effective before going on to phase 2, before going on to phase 3. But with COVID, we remember the government gave millions of dollars to these companies to say, we are going to foot the bill. Do not worry about failing. We just want these vaccines developed. So that made a huge difference in being able to develop them more quickly. Because we had so many volunteers, we also did some phases at the same time. So that doesn't mean we skipped a step. We just were able to say there was thousands of volunteers in one phase, while there were thousands of volunteers in another phase to accomplish them just a bit more quickly. Again, when cost is not a factor and you have lots of participants, you can do these things more quickly. And then last, just to note, normally we do wait for all the phase 3 studies to be complete before producing a vaccine. Of course, companies don't want to lose money, and making vaccines before they're have all the data could make you lose money. But the government, again, we were actually able to start manufacturing vaccines during the 3rd phase. So once all the research said, yes, they're safe and effective, we could get them shipped. Honestly, I think people probably remember within weeks, clinics had them in late 2021 or 2020. So next slide. And then just wanted to briefly note, so at least with the emergency use authorization, thankfully only the younger children vaccines have an EUA at this point. Just a reminder, the Pfizer and Moderna for 16 and up for Pfizer and 18 and up for Moderna have full FDA approval now as they've been monitored. But the EUA is still, mostly my takeaway from this is they're still looking at lots and lots of research and data, and they're reviewing the preclinical data. Just to know, it's not really skipping much of a step, but they're still having to review a lot of data analysis. And then part of the EUA is that they have to continue monitoring for safety. So, which has allowed certain vaccines, as they've had hundreds of millions of people get them across the country and world, really, they've been able to say these are still safe and effective to give full FDA approval. Next slide. I believe we're going to get in. Yeah, so some of the vaccine benefits, just going to continue to talk about this. We know that they're really good at preventing super severe illness, which I know that phrase gets thrown around, but think your lungs failing, your kidneys failing, dying from COVID. We know that vaccines have made it so very, very few people have actually died from COVID if they're fully vaccinated. They do provide consistent protection. I get some patients asking me I got COVID, why do I need a vaccine? Or, and just knowing that the amount of protection you get from the immune response you got if you made it through COVID is not consistent or guaranteed for 3 months. vaccines are a safer way to be protected. Omicron, we've seen milder symptoms of COVID, but there's still people getting very serious infection. It's still causing it to spread to people you love. And I feel like I still think about kids under 5 or my grandparents who are still at risk. And then there's still those long-term side effects of COVID that are kind of unpredictable, but long COVID is still with us. So the vaccines prevent against all that. They also decrease, transmission, and they protect from future variants, which we keep seeing. And, the less spread, the less opportunity that the virus can change and continue making us sick. So I think next we're going to go into the vaccines that are FDA approved. So lots of numbers here. I'm just going to highlight on a few of them. So this is mostly the Pfizer vaccine I'm going to talk about. And even in making this, it made me reflect on the fact that we knew it was very effective to the first COVID virus that was studied in 2020, 94% effective at any illness, but severe illness, this is pretty much like 100%, like no one was getting hospitalized if they were fully vaccinated. Delta, we did see a little bit of waning when you look at that kind of column with the 62 to 90%, but was still pretty effective. I think the main thing I wanted to encourage was that if you had gotten 2 doses of a vaccine early on, amazing. My push for the booster is that with Omicron and the fact that Omicron has had so many mutations, we still are seeing the vaccines protect pretty well against severe illness. But immunity 5 months, that 8 to 65% is actually saying 5 to 6 months after getting your 2 shots, your immunity might go down to like 8%. The 65% is if you're about a month out. And so with that booster though, which is again, like I said, with childhood vaccines, sometimes we just need more reminders for our immune system, and that can bring your immunity back up to like the 70%. And just a reminder, you can actually get boosted with either mRNA vaccine at this point. If you wanted a Moderna, you wanted a Pfizer. And then I'll talk in a little bit, but I think only like 30% of the population is boosted. Pfizer is now approved for 5 years and up. And I know the numbers, I don't want them to seem discouraging if, we only say 31% protection for younger children. That still is any infection. And the younger children, we're just seeing less COVID in general, milder COVID, and it's still very effective at preventing severe illness. So next slide with Moderna and Johnson & Johnson. Main takeaway here is, Moderna also same idea. If you need to get boosted, it does. You lose some protection over 5-6 months after getting your 2 doses, and boosting brings your immunity back up. And then the big thing is Johnson & Johnson has, if you did get it early on, my main point is that you should get a booster of an mRNA vaccine. We just kind of found that Johnson & Johnson really has not been effective against Omicron. And if you get like a Moderna, Pfizer, it seems like that combination of different vaccines stimulating your immune system provides very good protection. But if you haven't gotten any COVID vaccine, it's not really a good one to start with anymore. All right. And then so where are we at with vaccinations? Just kind of wanting to note that we're doing okay, but we could do better. So about 77% of the US has received 1 shot, which in the few months, 1 shot does elicit some level of immune response, but not, as we talked about with Omicron and different variants, it's not protecting as well as it could. And 65% are fully vaccinated. Only 30%, like I was saying, are boosted. So kind of a big reminder, if you haven't got that booster yet and you're eligible to do that. Some of the inequities we've definitely seen among like rural populations versus urban, and just, of course, there's always an access kind of question. There's been a lot of talk of like younger, patients and people not getting the vaccine as readily as people above the age of like 50. This graph just shows if you're 50 and up, it's closer to like 85% of the population is vaccinated. Whereas if you're under the age of 50, it's more like 60-ish%. And then we've, of course, seen some just like racial disparities in vaccine uptake. Thankfully, a lot of those are actually narrowing. I'd say I think the most recent is that if, for the African-American community, if they make up 12% of the population, they make up about 10% of people who've been vaccinated. So close to narrowing that gap that was maybe seen a little bit earlier into the pandemic and when vaccines were available. It was interesting that actually the Hispanic community, they had done some research that there was actually a flip in that, though they make up maybe 20% of the population, I think it's like 27 or 28% of the population's been vaccinated. So what do we, how do you get your vaccine? I think is my last slide. So just a reminder, it's very easy to get it now. I know early on, sometimes people felt like there was a wait or it was hard to make an appointment. Pretty much, I think any pharmacy at this point are doing walk-in clinics. You don't necessarily need an appointment, always good to check. I know Giant Eagle in particular has walk-in clinics. A lot of doctor's offices, this is just the Lawrenceville Family Health Center I work out of. We offer it to our patients. So kind of just a reminder, get boosted if you haven't, need it, and then just get vaccinated if you haven't yet. So thanks so much for listening. I'm going to actually pass along to Dr. Baxter. She's going to go into a little bit more for pregnant women and vaccines for them.
We'll wait until the slides appear, and I hope everyone is able to hear me. My earbuds are not working today. Thank you. If we can start the slideshow. Thank you. I'm Betty Baxter. I'm a member of Pittsburgh Black Nurses in Action, and I'm delighted to be talking to you about maternal immunizations because immunizations really have been at the forefront for the past 20 months. Prior to that time, there was less discussion outside of the maternal health space about the role of immunizations. Next slide, please. So I want to begin just to set the background for maternal immunizations, and they do protect birthing persons and their offsprings from infections. As Dr. LeCue was talking about the role of immunizations, they're so important within that maternal health space. I share with colleagues and friends and students that we're the only arena that you are always considering at least 2 people at the same time. You're considering the mother and the fetus. And if it's more than a single fetus, you may be considering up to 7 or 8 people at the same time. And we want to stress, as others have stressed, that we really want to begin within the maternal space, the immunization process prior to the pregnancy, and we'll get to that. There is evidence that suggests that healthy pregnant birthing persons' responses to vaccines, and we'll talk about the different vaccines, are comparable to those non-pregnant birthing persons. And I'm intentionally using the word birthing person because that is the new phrase now. You will see in the literature, you will hear in information provided to you, a transitioning away from just saying women to birthing persons for a number of different reasons, to be more inclusive of the transgender population also. Next slide, please. We'll begin our discussion looking at adult immunization recommendations, so because sometimes we forget, and then really hone it to focus in on maternal immunizations, preconception, prior to pregnancy, through the postpartum period. Next slide, please. Dr. LeCue gave an excellent overview on the types of vaccine, the activated vaccine, that really is a tiny bit of the virus, and the inactivated vaccine that has no part of a virus or a germ. And we'll talk about the different maternal immunizations that fall in both of these categories. Next slide. If you'll go back 2 slides, I had a slide on historical background, so I just want to go back to that. And if you can't, okay. If you can't find it, that's fine. Let me talk a bit about historical background. You can just stay on the adult immunization schedule for a bit. Historically, our first notification of the idea of a vaccine predates the 1970s, predates the 1900s, really begins back in the 18th century. And some of you may remember a discussion maybe in high school or in college about the role of Edward Jenner. And he's been credited for the idea of a vaccine. And Jenner became aware of milkmaids because he was living in a European area. Milkmaids, so this is way, way back. Maids were not infected with cowpox. And during his time, smallpox was a major, major problem, and people were dying of smallpox. And he was seeing these milkmaids milking cows, and cows have cowpox. They weren't infected. So when a young lad that he was treating, he decided to inoculate that lad by just really smearing on the hands, and we would never consider doing this now, smearing on the hands where the sores appeared on this young lad who potentially was experiencing smallpox. And he took some of the sores from the milkmaids, kind of disseminated that, crushed that, smeared that on the young lad, and that lad did live. And so this was the first kind of known action that led to the beginning of the thought of a vaccine. Now, it's interesting as we move forward, what, 300 years, 400 years almost, when we think of the beginning of the COVID-19 vaccine, as Dr. LeCue spoke about, we often hear, we know about Jenner, we know about Jonas Salk and the polio vaccine. Many of us are of the age to remember our parents talking about that. But we don't hear about the contributions of African Americans. So in the next minute or two, I want to just give a shout out for African Americans who contributed to the development of Jonas Salk polio vaccine, and about the contribution of at least one African American as relates to COVID-19 vaccine. Two Black scientists, both from Tuskegee Institute, Russell Brown and James Henderson, were instrumental in kind of helping with HeLa cells. HeLa cells became really important in the development of polio vaccine. And some of you may remember Henrietta Lacks and the cells that were used from her to really proliferate a number of different type of interventions and things that we now use, practices that are in place that really improve health. So these two Black scientists from Tuskegee with HeLa cells kind of they developed ways for maintaining the HeLa cells, keeping them at the right temperature. And this information was shared with Dr. Salk, and he went on to develop the polio vaccine. So just a side bit of history, sharing with you contributions of Black scientists. Also, Kissimmee Corbett has been instrumental in the development of the Moderna COVID-19 vaccine. And Dr. Corbett works at the National Institute of Health. So again, sidebar history in terms of the contributions of Black scientists. Now, returning to the adult immunization vaccine, you see a number of colors on the vaccine immunization schedule. This schedule is available to you on the CDC website, but I'm just going to run through the vaccines that are listed. Number one, influenza, an active vaccine. Normally we get influenza every year. It's annual now. It has become a part of our just who we are. We know that beginning in October, there's going to be messages floated around saying it's time for your vaccine. So influenza is an adult vaccine. Tetanus Now, I'm going to talk about tetanus as it relates to pregnancy, but we also need a tetanus vaccine if we have a severe cut. I'm from Louisiana. After hurricanes, typically when people are cleaning up or recent tornadoes, you're cleaning up, you cut your hand on something rusty, you need to get a tetanus vaccine. Measles, mumps, and rubella. We think of that for children, but we also need to think of that in terms of, and working with your healthcare provider, you may need MMR, measles, mumps, rubella, 1 or 2 doses, depending on your conditions. Varicella, or what we know as chickenpox, 2 doses if you were born later than 1980. If you are age 50 to 60 and 65 plus, additional 2 doses. As Dr. LeCue shared, sometimes our immunity begins to wane, begins to drop, and then we need these boosters to really push it back up so that we can fight against some of the germs that are out there. Zoster, that's the shingle vaccine. A number of 1 or 2 of my friends have had shingles, and they've been, the pain associated with that. At least 2 doses. These are all on the immunization schedule that appears in front of you. Hep A, Hep B, depending on your condition, you may need 2, 3, or 4 doses to bump that immunity back up. Meningococcal A, C, W, and Y, these are all different meningococcal vaccines. 1 to 2 doses. And this again is a discussion to have with your healthcare provider. Meningococcal B, 2 to 3 doses, depending on your own conditions. Haemophilus, there is a Haemophilus influenza, and people at highest risk for acquiring this disease or virus include individuals with sickle cell disease, individuals who are undergoing chemotherapy. Again, talk with your provider because you may need 1 to 3 doses depending on your own conditions. So there are about 10 adult immunizations that we need to be aware of. And sometimes we don't think about that. Yes, the flu. Sometimes we think of the tetanus, especially when we cut ourselves or step on something that's rusty. But there are so many other vaccines that we need to be aware of and keep that in the back of our mind. We know if we have children who are going away to college, they are required to get the meningococcal vaccine. But for adults, often we don't think about this litany of vaccines that we really need to pay attention to. And sometimes we don't pay attention to something like the zoster vaccine, and then we end up painful shingles that impact our activities of daily living and impact our comfort level. Next slide, please. So I want to begin our conversation in terms of the maternal health space, looking at measles, mumps, and rubella, as well as varicella. These are 2 activated vaccines. So that means we really need to have birthing persons make sure or ensure they have the appropriate immunity toward mumps, measles, mumps, and rubella, as well as varicella before they become pregnant. In addition to influenza, in addition to making sure that some of the other vaccines were in place. But these 2 vaccines are important for the birthing persons themselves as well as their offsprings, because there can be really severe congenital problems that are resulting from the birthing person not being vaccinated, becomes pregnant, then acquires the measles, mumps, or rubella, as well as varicella. Next slide, please. With these activated vaccines, your provider will be thinking and asking you questions as it relates to your pregnancy status. And this is just an overview of several questions the provider will be thinking about and maybe asking you about. Has the patient had intercourse since last normal menses? And that depends on what your normal menstrual cycle is. Has the patient been correctly, and those are key, correctly and consistently using a reliable method of contraception? Unfortunately, here in the States, we still have a number of unplanned pregnancies, and unplanned pregnancies reflect not using some reliable method of contraception correctly and consistently. Is the patient within 7 days from the first day of the menstrual bleeding? Is the patient within 4 weeks postpartum? And now we're seeing vaccines given before the birthing person leaves the hospital after a delivery. It's the safest time to give something like an MMR. And is the patient within 7 days post-abortion or miscarriage? And is the patient fully, key idea, fully breastfeeding and has not had a menses, and this in less than 6 months postpartum? So these are kind of the areas that the provider will be asking you about, or you should be thinking about. As the provider is saying, you have the opportunity now to update your MMR or the varicella vaccine. Next slide, please. On this list, we also have what in terms of preconception, which is an area we really need to emphasize within the maternal health space. It is great for birthing persons to become activated when they find out they're pregnant. It is wonderful they activate before or when they begin to think about becoming pregnant, that they can have some of these things in place to mitigate any type of adverse outcomes that may occur. So once again, just to reiterate, Hep A, Hep B, maybe during pregnancy, talk with your provider. Haemophilus, maybe during pregnancy, if you have sickle cell disease, or if you have been treated for cancer and received chemotherapy, talk with your provider. MMR, the measles, mumps, and rubella. Herpes virus, no, not during pregnancy at all. Preconception, fine, no during pregnancy. Influenza, yes. Meningococcal, maybe depending on your condition. And definitely if you're a first-time student, college student, and you become, you need to prepare for college, get that meningococcal vaccine. And many colleges do no longer allow a student to come if they have not received the vaccine. Pneumococcal vaccine for pneumonia. Maybe particularly if you're at risk for diabetes, and we know that a number of birthing persons do experience gestational diabetes during pregnancy. This is some discussion you need to have with your with your provider. The Tdap, yes, and we're going to talk about more about Tdap in the next couple of slides. Varicella vaccine, no. Next slide, please. We begin with Tdap because it's so important. And this is something that occurs for each pregnancy. It's not a one and done. Okay, I got my vaccine. Oh, in my last pregnancy, I'm good. No, your provider will be talking with you about Tdap every pregnancy. And typically your Tdap vaccine is given the third trimester, 27 weeks gestation to about 36 weeks. So beginning around 8th month, shortly after your 8th month to your 9th month is when you're more likely to receive the Tdap vaccine, and talk with your provider about that. Influenza. Anytime you want to get it as early as possible during your pregnancy, particularly, the influenza months typically begin in October, and often they extend to March or even April. Fortunately, one of the really glimmer of hope during this COVID-19 vaccine was in 2020 when it arrived here in the States. That year, with people masking, the incidence of influenza was extremely, extremely small. I think that was the lowest incident rate that we had ever had in this country. So that's another shout out for the use of the mask. COVID-19, that vaccination is safe. It took the FDA a while to get out the information to local medical organizations, nursing organizations, to really encourage pregnant birthing persons to get the vaccines. So share that with your family, with your friends, that these 3 vaccines, including the COVID-19, are so important for our pregnant birthing persons. For the birthing person, the data suggests that when the birthing person was pregnant, acquired COVID-19, increased risk for ending up in an intensive care unit, increased risk for ending up being intubated. Then this increases the stress on the fetus. And within the African-American community, we know that we have one of the highest preterm birth rates of any group. And any action that can reduce stress on the fetus, the baby, will lead to healthier outcomes within the African American or Black community. Next slide, please. This is a slide that kind of reaffirms the need for influenza vaccine and the Tdap vaccine. Part of the Tdap vaccine is pertussis, known as whooping cough, that babies experience with this really loud coughing, and often you have to return to the healthcare provider. So you can eliminate or soften the occurrence of these diseases with vaccination. And any stress, influenza is a stress, Tdap is a stress. Any stress can lead to adverse outcome for yourself and for the fetus. Next slide, please. This slide really kind of brings to our attention the importance of the COVID-19 immunization for pregnant birthing persons. You see the percentage of death increased as a result of COVID-19. You also see the percentage of pregnant birthing persons who have been vaccinated, around 31%. If we could get to 50%, that would be even better. So the final push is, if you know of someone if you know of family considering becoming pregnant, family members who are pregnant, then please emphasize the need for them to become vaccinated. Next slide, please. Again, it is just not during pregnancy. We want these immunizations to become a part of the natural behavior of birthing persons. It's before, it's during, and it's after. When that birthing person gives birth, before leaving the hospital, they can acquire, can I get my MMR? If they had a low immunity rate during the pregnancy, they can bump that up. They can get within that first 6 weeks of postpartum. It does not impact breastfeeding. So this is the type of information we should be sharing, because some birthing persons will say, well, that's going to impact the breastfeeding. It does not. The data does not suggest that, nor in working with birthing persons during the postpartum period. We haven't had that complaint. Second to last, final slide, please. Next slide. similar to COVID-19, the body takes a time to build up, get that boost from the vaccinations. So something like Tdap, we want you to get the Tdap between the 27th and 36 weeks. So 4 weeks after, let's say you get it at 36 weeks, 4 weeks later, and you deliver, the body has time to build up the antibodies, and then that can transfer into the baby through the placenta into the baby. And so the baby gets some passive immunity from the vaccine also. Next slide, please. Summary. Maternal immunizations protect birthing persons and they protect their offspring. I think that's the final slide. And before a question slide, here are the sources. The CDC has a lot of information. You can even Google March of Dimes, a lot of information related to vaccinations and pregnancy and immunizations. So that's available to you. Most people Google, so get on Google, look at what is available to you. I'm going to return it to Michelle as we move forward. Thank you.
Thank you, Dr. Baxter. Thank you and Dr. LeCue for such wonderful presentations. Right now, we're going to go through our question and answer session. I do have a question for you, Dr. LeCue. One of our questions from our audience is, Dr. LeCue, you educated us on how the FDA continues to monitor safety. Can you give us more details how they obtain that data for the COVID-19 vaccine?
Yeah, absolutely. So for many people who've gotten the vaccine, you probably remember they asked you to enroll in a vSafe kind of app on your phone. So you actually kind of become part of their research once you've had a vaccine with the EUA. Okay. So that's probably the most common. I know I get questions still asking, am I feeling well? Did I get sick? And they did that too for, I think, monthly even right now. So that's one of their main ways of continuing to gather data. I believe in addition, they had the initial cohort of people in their vaccine trials that continue to get monitored for, the months following.
Okay, great. I also want to ask a question about the fourth vaccine. Will there be any difference between the third vaccine, the booster, and the fourth vaccine they're looking to make mandated?
Yeah, to my understanding right now, I think you're asking about how I think the FDA just recently is saying for 65 and up that there could be a fourth Pfizer vaccine given. I believe it's still the same formulation as the other vaccines. And I think, again, with the understanding that immunity just seems to maybe wane, and for higher risk groups, that's beneficial.
Okay, thank you. That brings us into one of our last questions for Dr. Baxter. Dr. Baxter, since the CDC has changed the term from fully vaccinated to up to date, what are your thoughts by the end of 2022 that the CDC will make the COVID-19 vaccine added to the required adult immunization list?
I think that's very likely. Mm-hmm. I think as this virus mutates, it may be similar to what some are already talking about, our annual kind of like the flu vaccine with the mutation. That becomes just a part of our routine healthcare actions that we just aware every year or whatever, we will have this type of booster.
One more question we have in the chat box. Should birthing persons be concerned about side effects from the vaccines for the baby, like autism?
We've heard that as a myth. We don't see that really in the evidence, but you always are concerned about offspring. But we haven't seen that in the evidence in terms of autism. We've had some changes in society views about vaccines, to be very honest. We have groups known now as anti-vacciners, and one of their major pitches has been measles, mumps, and rubella associated with autism, and all the data suggests that does not exist. So I think, as we move forward, I think as providers and all of us, we're going to have to determine how do we deal with misinformation and disinformation. Those were two terms that we didn't have to really think about that much, maybe 30 years ago or 20 years ago, or even 10. But that's an issue now.
One more question did pop up in our chat box. This can go for both of our panelists about the new oral medication for treatment of moderate COVID at home. What are your views and education you've had on from either one of you?
Yeah, I mean, I can speak a little bit to, because I know there's been recent approval. I think it's like the molnupiravir. and in all honest, I will say that I know there's been approval. I have not been able to like successfully prescribe this to patients yet, like at least from a provider's standpoint. I think there's still been some difficulty in finding patients who are finding that they're sick early enough. Because I think it's approved, you have to have very mild symptoms. It has to be identified, gosh, I think in the first 2 or 3 days, and then you have to then be able to like call your doctor and pick it up. So I think from a practical standpoint, it's really early, like to be honest. I know there's recent approval, but I haven't like had patients or found people within that window to actually prescribe it.
And I would agree with Dr. LaQ. I think it's, this is one of the newer options. We are really, and that will come along as people begin to understand what it is, how available it is, its limited availability. We're trying now to really focus on what we have and is out there and very available.
Thank you both. For our final and last question, this is for you, Dr. Baxter. Can you tell us the age the person should be considering get the shingles vaccine? And should they get it if they've already had the chickenpox vaccine?
You can get it if you already had the chickenpox vaccine. It's typically for adults over 50. And actually your provider will probably tell you, it's time to think about the shingles vaccine because you don't want to have shingles. It's very painful. It impacts your activities of daily living. My colleagues have had to take off work, and shingles can be activated during stressful periods. And if any period has been stressful, it's been in the past couple of months.
Yes. Thank you. I want to thank both panelists for your presentation, and I'm going to turn it over to Joanne Boyd for the end of our sessions.
Thank you, Michelle, and thank you to Gateway Medical Society and to our speakers, Dr. LaQ and Dr. Baxter, for a very informative hours and sharing your expertise with us. And thank you to our audience for taking time out of your day to get educated on the whole notion of vaccine awareness and prevention and the importance as we continue to strive to bring this pandemic under control. It helps us to understand more what we can do as a community to do our part as we learn more about the science, as we learn more about the facts, and learn more to rely on those facts versus some of the myths that are out there. We become better advocates for our health. So thank you to all of you for this time. We also will be randomly selecting one person that has joined the webinar today to receive a handheld thermometer in the mail. And then we will also be selecting 10 folks who have joined today to receive another small gift as our appreciation of you taking the time to join into the webinar today. So with that being said, we'll bring this to a close, and again, enjoy the rest of your afternoon. Thank you.